Together with our brochure and our information pack, we are sure that the useful information shown in this video will allow you to make the correct decision. Rhinoplasty. Rhinoplasty is a procedure in which the surgeon's precision and artistic sense plays an important role. The goal in rhinoplasty is that the new nose does not call attention to itself, but blends fully into the general context of the face. Since there is no perfect or ideal nose, the time to explain what you want and expect from the surgery is during your first visit to your surgeon. The rhinoplasty procedure can be done under general anesthesia or with a local anesthetic and sedation. The nose is primarily a sensory and respiratory organ. It is a complex structure formed of bones and cartilage, covered on the inside by respiratory mucous membrane and on the outside by skin. It also functions as an olfactory organ and provides protection against the environment. These factors are important since rhinoplasty, in addition to achieving a certain aesthetic level, should preserve all nasal functions intact. The procedure is performed through incisions made to the inside of the nose, which we refer to as closed rhinoplasty. It can be performed by adding another almost imperceptible incision on the columella, the central column of tissue separating the nostrils. This is what is called an open rhinoplasty. Your surgeon will indicate which method is best for your case. Initially, the dorsum or bridge of the nose will be reduced or augmented as needed. We can use the patient's own tissues to give height or support to the nasal pyramid. The tip of the nose is the most delicate part of the procedure, and the surgeon must exercise the greatest care. We can narrow the nostrils by reducing the size of the alar cartilage, always taking the utmost care to preserve its structure. By suturing, we can modify the cartilaginous structure of the nasal tip. We can also join the cartilages that form the columella and even insert cartilage to stabilize it. The use of cartilage grafts in this area to stabilize or give greater definition must be done with the greatest finesse and must be firmly secured. Finally, it may be necessary to fracture the nasal bones to close the space created in the dorsum. This maneuver is responsible for small hematomas that usually appear. After the procedure, a splint is normally applied. Contrary to its appearance, rhinoplasty is not a painful procedure. However, a certain amount of post-operative edema is normal, as is the presence of bruises which tend to recede in the first weeks. It is important to keep in mind that judgments cannot be passed on the results of a rhinoplasty until several months or even a year have passed.